By. It would carry us forward, but it would be a financial strain to the state's budget, Piper said. Allotment for 2017, which would fund the program for about 9 months. Doing so, however, would come with a federal penalty of $10 million to the state. The House, meanwhile, is also expected to hold a markup on a CHIP measure this week, but has not yet released a bill, which is expected to be drastically different than the Senate's. Sources say the House is unlikely to keep the enhanced Obamacare funding for more than 1 year. Its bill is also expected to include funding for community health centers and other health programs, which could make it hard to pay for. In Texas, funding is expecting to dry up in January or February for a program covering nearly. By. This is a terrible situation for everyone who relies on CHIP to be a functioning program, said Minnesota Department of Human Services Commissioner Emily Piper. Story continued below. Lawmakers say they are still planning to fund CHIP this year, though they haven't acted with urgency so far. Getty Images. By the end of the year, according to the nonpartisan Kaiser Family Foundation. If Congress doesn't approve funding by then, some state officials say they expect to terminate enrollment in the beginning of next year, or shift eligible kids to other government insurance programs with potentially less federal support. CHIP, now in its 20th year, is jointly funded by the federal government and the states. Historically, the federal government has provided an average of 71% of the funding, but a provision in the Affordable Care Act boosted federal funding to the states by 23 percentage points over the past 2 years. Lawmakers say they are still planning to fund CHIP this year, though they haven't acted with urgency so far. The Senate last month unveiled a bipartisan measure, S. 1827-115, that funded the program for 5 years and preserves Obamacare's funding raise for 2 years before it's gradually phased out. The bill was overshadowed by the GOP's last-ditch failed effort to dismantle Obamacare, but lawmakers are expected to mark it up in committee this week. Families want to know as soon as their coverage is potentially threatened, said Colorado Medicaid Director Gretchen Hammer. Families know that they have coverage through January, and they want to know what their options are. Even if Congress comes back and gives them all the money in the world, it's very distracting and destabilizing, said Matt Solo, Executive Director of the National Association of Medicaid Directors. Get the latest on the healthcare fight, every weekday morning, in your inbox. Like Minnesota, Utah is considering moving eligible children to Medicaid if the money runs out, said Utah Medicaid Director Nate Checketts. The state is also considering moving some kids to the Obamacare insurance marketplaces, where they can get subsidized coverage. However, officials are still working through the logistics. By Richard Primus. 400,000 children and 36,000 pregnant women in the state. Texas budget writers estimated Texas would receive $3.2 billion in federal funding for CHIP over 2018 and 2019. Despite bipartisan agreement to continue the program, lawmakers missed a September 30 deadline to renew funding. Many say they still have time to get money to states, despite progressive groups decrying over the weekend that Republicans allowed the program to expire, triggering a qualifying event that allows them to purchase Obamacare coverage through the state's exchange. More than 75,000 children, and nearly 800 pregnant women are currently enrolled in Colorado's program. The Texas Health Department has warned that it would begin winding down the CHIP program after funding runs out early next year. But close observers say the state hasn't made serious preparations, because Congress is widely expected to continue funding the program. State officials say the funding uncertainty is already causing logistical headaches. A number of state officials are looking for ways to keep their programs afloat, hoping Congress will approve money for the federal Children's Health Insurance Program before they have to cut off coverage. Right now, it is a tough balance between the reality of the urgency facing state CHIP programs, and not wanting to create panic for families whose children depend on CHIP coverage, said Kristen Golden Testa, director of the California Health Program at the Children's Partnership. California's Department of Health Care Services said it's still business as usual for the state's CHIP program, which receives more than $2 billion a year and covers about 1.3 million children and pregnant women. The program is expected to run out of funding in December. Without getting new funding from Congress soon, Minnesota is considering tapping into its unspent federal. Colorado is also looking at Obamacare's marketplaces as a fallback option. The state's CHIP program, which is expected to run out of money by the end of January without action from Congress, plans to notify families in mid-December that coverage may be terminated. With so many families across the coast impacted by Hurricane Harvey, CHIP and Medicaid help families maintain coverage, said Lou Fragoso, president of Texas Children's Health Plan, which covers 430,000 people in Texas, about 15% of whom receive CHIP. This is critical, especially for those in communities devastated by the recent storm and flooding. Bye. States are scrambling to shore up the government health insurance program that covers 9 million low-income kids after Congress failed to meet the deadline to renew its funding over the weekend. By signing up, you agree to receive email newsletters or alerts from Politico. You can unsubscribe at any time. Missing out on the latest scoops? Sign up for and get the latest news every morning, in your inbox. While states won't run out of money immediately, at least 10